How do you know if what you're experiencing is a heartburn or something more serious? Heartburn typically feels like burning behind your breastbone. It often comes after eating, especially if you eat something that is spicy or fatty, and it may worsen when you lay down or when you bend over. You may also taste acid in your mouth. For heartburn relief, you may want to take antacids, and you also want to sit upright and drink water. You also need to avoid laying down for about 3 hours after eating. But the problem is heartburn can also be a heart attack. The difference is a heart attack typically feels like pressure or squeezing or fullness or pain in the center of your chest, and it lasts more than a few minutes, and it may spread to your shoulders and to your neck or to your jaw and your arms. You need to call 911 immediately if you have any sort of chest pain with sweating and shortness of breath. If you also have any sort of nausea or lightheadedness or pain that radiates to your arm or to your jaw, or if you just feel like you're about to die. Women often have different symptoms, and this is things like unusual fatigue. They can have back pain or shortness of breath without the obvious chest pain, which is what is used to diagnose heart attack. So don't wait to see if the symptoms improve, because a heart attack requires immediate treatment, as every minute matters. So when in doubt, get checked, because it's better to have it be heartburn than to ignore a heart attack. And if you have a history of heartburn and this feels identical to your normal heartburn and responds to antacids, then it's likely a heartburn. But if anything feels different or more severe, then you need to get evaluated and you need to go to the doctor. A lot of people who have risk factors for heart attacks are people that have a family history of heart attacks. If you smoke, if you have high blood pressure, if you have high cholesterol, if you're diabetic, if you're obese, if you're over the age of 45 for men and 55 for women, and if you frequently mistake heart attack symptoms for heartburn, and if you frequently have a lot of symptoms that can affect your chest, then you are at risk for getting a heart attack. Never drive yourself to the hospital if you think you're having a heart attack. You have to call 911, because your life is worth the emergency room visit, even if it turns out to be a heartburn and a hefty hospital bill. Stay healthy.